Hello everyone, my name is Jenny Raymond. I'd like to welcome you to an overview of the information available for the 2015 influenza season. In this session we will discuss what is influenza and why is influenza vaccination important for all people, including practice staff and the community, the composition of the 2015 vaccine, eligibility criteria for funded vaccine, recommended target groups for influenza vaccine, dosage information. We will cover contraindications to the vaccine, adverse events that may occur, and the reporting requirements of an adverse event if necessary. Specific information for children under 5 years of age, notification requirements for influenza, and a quick overview of the number of current notified cases. Influenza is highly contagious and spreads through airborne droplets by the respiratory route, for example, through coughing and sneezing. Influenza causes a wide spectrum of disease, from no or minimal symptoms to respiratory illness with systemic features to multi-system complications and death from primary viral to secondary bacterial pneumonia. Symptoms include chills, sweating, high fever, that is up to or above 39 degrees Celsius, weakness, generalized muscle aches and joint pains, particularly back and legs, non-productive cough at first, later it becomes more severe and productive, and a headache. The administration of influenza vaccine to persons at risk of complications of infection is the single most important measure in preventing influenza infection and preventing mortality. The composition of vaccines in Australia is determined annually by the Australian Influenza Vaccine Committee. Currently available influenza vaccines provide protection for about a year. Low levels of protection may persist for a further year if the prevalent strains remain the same or undergoes only minor antigenic shift. Continuing protection requires annual vaccination with vaccine containing the most recent strains. The 2015 Southern Hemisphere influenza season vaccine strains are A. California 2009 H1N1-like virus, A. Switzerland 2013 H3N2-like virus, and B. Phuket 2013 Yamagata lineage. Government-supplied vaccine brands include Fluravix by GSK, Fluvax by BioCSL, do not use in children under 5 years of age, Vaxigrip and Vaxigrip Junior by Sanofi-Aventis. In 2010, an excess of fever and febrile convulsions following influenza vaccination was reported in children less than 5 years, particularly children aged less than 3 years of age. This was associated only with one manufacturer's vaccine, Fluvax and Fluvax Junior by CSL Limited. Following vaccination with this vaccine, febrile convulsions occurred at a rate of 4.4 per 1,000 doses in children aged less than 5 years of age. Remember, the BioCSL Fluvax is not registered by the TGA for use in children less than 5 years of age and must not be given to this age group. Eligible groups for free government-supplied seasonal influenza vaccine include people who are 65 years of age or over, pregnant women at any time during their pregnancy. All influenza vaccines are acceptable for use in pregnant women, Aboriginal and Torres Strait Islander people aged 6 months to less than 5 years and 15 years and older, any person 6 months of age and older with medical conditions predisposing to severe influenza, also those patients with cardiac disease, chronic respiratory conditions, immunocompromising conditions, renal disease, diabetes and other metabolic disorders, chronic neurological conditions, hematological disorders, and children aged 6 months to 10 years receiving long-term aspirin therapy. ATAGI also strongly recommends influenza vaccine for the following groups. However, these groups are not funded under the National Immunisation Program unless they also fall under the previous mentioned categories. Those patients with Down syndrome, obesity, BMI greater than or equal to 40 kilograms per metre squared, chronic liver disease. Other recommended but not funded groups include residents of aged care facilities and long-term residential care facilities, people who may transmit influenza to persons at increased risk of complications from influenza infection, homeless people, persons involved in the commercial poultry or pork industry or in culling of poultry or pigs during avian or swine influenza activity, persons providing essential services, persons travelling during the influenza season, especially if it's known before travel that influenza is circulating in the destination region. Recommended doses of influenza vaccine. On the screen are the recommended doses for the influenza vaccine. Please note that the plus sign indicates 2 doses at least 4 weeks apart are recommended for children aged less than 9 years who are receiving influenza vaccine for the first time. The same vial should not be reused for the 2 doses. The asterisk symbol represents if a child 6 months to less than 9 years of age receiving influenza vaccine for the first time inadvertently does not receive the second dose within the same year, he or she should have 2 doses administered the following year. The plus and minus sign indicate 2 doses at least 4 weeks apart are recommended for the immunocompromised persons receiving influenza vaccine for the first time. See 3.3 Groups with Special Vaccination Requirements in the Australian Immunisation Handbook, 10th edition 2013. And remember, the same vial should not be reused for the 2 doses. Contraindications. The only absolute contraindication to influenza vaccines are anaphylaxis following a previous dose of any influenza vaccine or anaphylaxis following any vaccine component. Persons with known egg allergy. Several recently published guidelines and reports have indicated the risk of anaphylaxis associated with influenza vaccination and egg allergic patients is very low. Persons with an egg allergy, including anaphylaxis, can be safely vaccinated if influenza vaccines that have less than 1 microgram of residual egg ovalbumin per dose. The product information of the vaccine should be checked for the vaccine's ovalbumin content prior to vaccination. However, there is still a low risk of anaphylaxis, so it is essential that such patients are vaccinated in facilities with staff able to recognise and treat anaphylaxis. Persons with a history of Guillain-Barré syndrome, or GBS, have an increased likelihood in general of developing GBS again, and the chance of them coincidentally developing the syndrome following influenza vaccination may be higher than in persons with no history of GBS. Diagnosis of GBS is complex and must be made by a physician. Co-administration of influenza vaccines with other vaccines. Influenza vaccines can be administered concurrently with any other vaccine. However, there is a small increased risk of fever and febrile convulsions with the concurrent administration of influenza vaccine and the 13-valent pneumococcal conjugate vaccine in children aged 6 months and less than 5 years, especially those children in the 12 to 24 months of age. Given the reported increase in the risk is relatively small, providing the 13-valent pneumococcal conjugate vaccine and influenza concurrently is acceptable. However, providers should advise parents of the risk and outline the option of administering these 2 vaccines separately with an interval of at least 3 days between them. Adverse events. Fever, malaise and myalgia occur commonly in 1 to 10% of persons who receive influenza vaccination. These adverse events may commence within hours of vaccination and may last for 1 to 2 days. Local adverse events in duration, swelling, redness and pain occur in more than 10% of vaccine recipients. Post-vaccination symptoms may mimic influenza infection, but all currently available influenza vaccines do not contain live virus and so do not cause influenza. Immediate adverse events such as hives, angioedema or anaphylaxis are a rare consequence of influenza vaccination. They probably represent an allergic response to a residual component of the manufacturing process, most likely egg protein. Persons with a history of anaphylaxis after eating eggs or a history of severe allergic reaction following occupational exposure to egg protein may receive influenza vaccine after medical consultation. So how to report an adverse event? Health professionals should be aware of the method of reporting for their state or territory. In Victoria, adverse events should be reported to SafeVic, which stands for Surveillance of Adverse Events Following Vaccination in the Community. For online reporting, go to their website, which you can see on the screen, www.safevic.org.au. Or you could telephone on 1300 882 924 between the hours of 10 a.m. to 4 p.m. Monday to Friday. A message with contact details can be left if outside of these hours. You could also email safevic@mcri.edu.au or fax 03 9345 4163 or use the post SafeVic, Murdoch Children's Research Institute, care of the Royal Children's Hospital, Flemington Road, Parkville 3052. I'll give you a few moments to write down these details that you can see on the screen. Notification requirements. Both influenza type A and B disease are Group B notifiable diseases and must be notified in writing within 5 days of diagnosis. This notification can be made online. You can see the website address online. You can write that down. Notified cases for Victoria as of the 18th of March 2015. There were 75 cases this current week, 36 cases the previous week, and so you can see the numbers are increasing. And to date, there are 482 cases notified from just January to March in 2015. In 2014, the total cases notified were 9,933. And in 2013 it was 5,829. Vaccine preventable disease summary can be found at the ideashealth.vic.gov surveillance tabulated summaries, and that website address is also on your screen at the moment. Once again, I'll give you a few moments just to write down those website addresses. The Department of Health Victoria has resources available for both seasonal influenza and pandemic influenza. Once again, their website is on the slide in front of you, health.vic.gov.au. The information provided in this webinar was resourced from the Australian Immunisation Handbook 10th edition 2013 and ATAGI, which stands for Australian Technical Advisory Group on Immunisation Statement clinical advice for immunisation providers regarding the administration of the 2015 seasonal influenza vaccines dated February 2015. This concludes our webinar. Thank you for listening. Goodbye.